in terms of thrombectomy for large vessel occlusion, the real controversies have to do with patient selection. So right now, the trials that have all been done have had inclusion and exclusion criteria that kind of select patients that are optimal for thrombectomy, and so now there's a lot of interest in looking at patients that were originally excluded by those inclusion-exclusion criteria because they could potentially benefit from thrombectomy. In some cases, we really strongly think they do benefit, but it's not yet been proven. So one of those issues is patients that have already established a large core, so they have a large vessel occlusion and maybe half of the territory is already irreversibly damaged, but there's still the other half. In the prior studies, there was a cutoff of, you had to have a relatively small core to even be enrolled. So now there's debate whether patients with larger cores should be treated or not, and that's currently being addressed in randomized trials right now. And so there's some data that suggests that they do benefit. And then there's the other controversy that's kind of, I guess, in everyone's mind right now is low stroke scale patients. So the original trials, you had to have a certain severity of deficit before being taken, and now there are patients we know that come in with large vessel occlusion, but they're relatively minor deficits, and then the question is, will they worsen, and will it be beneficial to just open up the vessel in those patients? That's also an area of active research right now. And then there's the expansion of thrombectomy to different vessels, namely the distal circulation. So the initial trials were done in the sort of larger of the large vessels, the internal carotid and the middle cerebral artery, and so now there's trials looking at the M2 segment and M3 segment of the middle cerebral artery, so smaller distal branches where the new devices can potentially the procedure itself is technically feasible, and so the question is, will the patients actually benefit? And that's an area of research as well.